All right, everybody, we're going to get going. While they do some tech work behind me, I'm Rich Eckroat. Welcome to April's Project Vision meeting. Co-chair Catherine is not here today, so I'm flying solo for my first time, so please go easy on me. As my welcome, I just have a couple of things I'd like to note. One, that if you received an agenda where there's a QR code on there, please scan it. Give us feedback, let us know how we're doing. I'm very new to this role. It's nice to know what's working, what's not, what you want to hear, what you don't want to hear. Please provide the feedback. So if you need help with the QR code, just let me know and we can take care of that. Also, Chief Prouty is in the back of the room, and if you want to be on the, if you would like to be added to the listserv, if you're not on the project listserv, please see Chief Prouty. He will add it to you during this meeting. Or he will add you to the listserv during this meeting. Also, at the end of this, we'll roll into our pizza, also known as networking time. Please utilize that time as networking time. If you don't know somebody here, introduce yourself. I'll be going around doing the same thing, and if you don't know me, feel free to introduce yourself. That's what this is for. It's for networking with one another. So use that time. You can eat pizza for sure. We all will. But let's introduce ourselves to one another. So, without further ado, I would like to open it up to new visitors to introduce yourself. Or do we have any new folks here today? Oh, right here. So we do have a microphone in the front right here. We don't have portable mics today because of some tech issues. So just come right up here, introduce yourself, let us know who you are. Yes.
Hi, folks. My name is Connor Timmons. I'm the Executive Director of HomeShare Vermont. We don't currently operate in Rutland and Bennington counties, but we are eyeing the area and thinking about how and when and how that would all work for us. So this is just me doing a little recon. So if you have thoughts or ideas or anything like that, please come and see me. I'll be in the back feeling embarrassed.
All right, welcome. Come on, step on up. Thank you.
If I'd have known that I had to get up in front of the microphone, I never would have raised my hand. But
Me either.
I'm Sherry. I'm just here with fellow people from ARC. It's my first time. I'm a volunteer, so
Great.
yeah.
Welcome. Thank you for being here. Anybody else new? Come step on up to the mic.
Hello, my name is Kathleen Kilborn, and I'm from NAMI Vermont, the National Alliance on Mental Illness of Vermont. And I've been here in a previous role when I was the Executive Director for Vermont Suicide Prevention Center. But today I'm just here to share about free resources because we are a statewide organization and to learn from all of you how we can connect and partner. All of our services are free and grant funded. So let's chat. Thanks so much.
Thank you. Welcome. Step on up.
Hi, I'm Stephanie Lovelet. I'm here with ARC. I've been there for 18 years, and it's a good organization for people with developmental disability.
Welcome, Stephanie. Anybody else? One more.
Hi everyone, good afternoon. My name is Vishwas Pradhan. You can call me Biz. I'm representing Community Health. Brand new in Vermont. I've been here for 2 months, a little over 2 months, and I serve as Director of Population Health and Quality in Community Health. So any preventive primary care questions, please reach out to me. Thank you.
Well, welcome, and you're arriving when the sun is starting to shine, so this is very good.
Good afternoon, everybody. My name is Heather Rigney, and I'm the statewide coordinator for Medical Reserve Corps. I am also privileged to be one of your speakers today, so thank you all for inviting me today.
Thank you. Thank you for being here. Any other new visitors that just walked in that would like to introduce themselves? Okay, seeing no hands, I'm going to move on to a brief situation table update. So I did not come prepared with a slideshow today for that, but I'm just going to rattle off some stats at you. If you have questions, please feel free to ask. Next month, I'll make sure that I have, we switched over our data tracking systems between last meeting and this meeting. So mining data through that is a little different, and I will make sure that next month I have good solid data for you that everyone can not just listen to me, but also see. So this is since our last Project Vision meeting in March. We have met we've had 4 meetings, 4 situation table meetings since our last Project Vision in March. We have opened a total of 4 situations. Again, the top 3 risk factors remain the same. Overall, housing, mental health, and physical health. And again, if you were here last month for my situation table presentation, you'll know this is a national trend. We're seeing this across the nation. Those are generally the top 3 risk factors. The total number of people supported through the situation table in the last month is 4. 2 of the 4 situations that we handled had intimate partner violence, and 2 of those 4 situations also had children in the home. So these are the types of situations that our group is regularly working with. And since our inception, the situation table has handled 68 cases with 88 total people supported in Rutland County, which is pretty great work considering these are individuals and families who are what we define as an acutely elevated risk. And it's our job to sort of bring them back from the edge and stabilize them with the wraparound services that the situation table can employ. So next month, again, I'll come with an actual better presentation for you for these statistics. But that's what I have for right now. Is there any questions? Okay. Moving on. I would like to open up the mic to the mayor. Come up here for mayor's remarks. Welcome.
Thank you. I'm wearing my new hat, so I'm not CEO at Brock Community Action, but I still have an affinity for them and the great work that they do. So I'll be there when they need me. They'll have a friend in the mayor's office going forward. But I did want to thank you. And mayor's remarks are on the agenda, so I think that's very important that the mayor comes. And I intend to be attending these meetings. Most of them, whenever I will make this a priority. And one of the reasons I'm going to do that is because this work that you're all doing is significant. As you know, as an alderman, I was running on supporting proactive policing, and this is all part of that. So I really feel that it's important that I be here, not now as an alderman, but as the new mayor, and that I support your efforts as we go out and do what we do throughout the month. I did want to say, when you mentioned Chief Prouty, I did want to say, doesn't that have a ring to it? Chief Prouty. So I'm really excited to have the chief on board as the official chief, not the interim anymore. He's the chief. One of the first things I was able to do on the job was to actually sign the contract with the chief of police. So that is, I made sure that by that Friday afternoon, before I went home, that we sat in my office and literally signed the contract. Isn't that right, Chief? So I said, this is on my first week on the job. I'm going to make sure that I dot that I and cross that T and get that accomplished, and we did. So I'm very proud to be able to be working with the chief. He's doing a great job already, as you know, no doubt about that. But thought I would say it out loud while we're here. I also wanted to mention that I was able to make a couple of appointments that were approved on Monday, I should say, of this past week, which was the chair and the vice chair of the police commission. So Pat Brome is officially, again, remains chair of the police commission for the next year, and appointed the vice chair, which is called for by charter, which is Peg Flory. So both of those were approved unanimously by the Board of Aldermen on Monday night. One of the things that I'm doing is working very closely with the Board of Aldermen. So the Mayor's office and the Board of Aldermen are working really closely together. We'll be doing that for my next year, because I think that's a really, really important thing that we must achieve together in order to get things done in Rutland. And so far, so good. The Board of Aldermen's meeting Monday night was a total of 38 minutes. And that is all about communication and working together. So I was very proud of what we're accomplishing there as well. We've got a great board, and together we can do great things. I also wanted to mention I appointed a new member of the Police Commission, and that is Matt Whitcomb. So he's a former Rutland City Alderman and was willing to step up and become the 5th member of the Rutland City Police Commission. So very excited about that. Now that will be confirmed potentially and hopefully and likely on April 20th by the Board of Aldermen as well. So we'll have that member in place. And I wanted to also just mention I attended the RUTSTAT meeting last week. I've been attending those anyway as a city alderman, and also wearing my Brock Community Action hat because it's very important to know those statistics and all of the amazing information that the police department puts together on a 2-week basis. Every 2 weeks, these snapshots of what's going on from not only crime but also the proactive policing. And so I invite you to go to those anytime that you, as a public, they meet at the police department, and so you can just walk in and join. Some of you are already there, I know, so good to see you. But that's really, really tremendous information. And then one last thing I wanted to mention that, and this will be, shameful or not shameful, but not humble, I guess I would say. A little promotion for PEG TV. But I started something new, and it's called From the Mayor's Desk. So on PEG TV now, and this will be my promotion on Thursdays at 12:30, which is right now I think I'm on. So I'm not watching. Fridays at 7:30 a.m., but Saturday evening at 7 p.m. So that's the time, pop the popcorn, watch From Your Mayor's Desk. It's a half-hour program that I'm doing that basically is communicating what we're doing every 2 weeks from the mayor's office. And I think that that's going to be a really important addition to our communication. I'm kind of nicknaming myself the communicator in chief. And one of the reasons I'm doing that is because a lot of what we need to do is to communicate with you, with our public, with our viewers, with our electorate, and with our residents, and all the great organizations that make up this community. And one of the things that happens is a lot of speculation. Well, sometimes people speculate only because they actually haven't heard what it's all about. They haven't heard the details. So my job will be every 2 weeks in a half-hour program on PEG TV to bring you details about things that are going on. And I think that will really be enlightening. It'll be really positive information. And we're talking about everything from what's going on at PD to what's going on in our business community, openings, even closings, and all of the other kinds of initiatives that people might be interested in hearing about. And so I just wanted to lastly wrap up by saying that spring is here, and I see Sergeant Magano back there. I think that the bike patrols will probably be starting soon. Is that? And I did see the chief out there about a week and a half ago, and I said, wow, okay, he's really, really dedicated to this bike patrol, because it was cold and a little rainy that day, and I thought, okay, he's jumping the gun in my book, but I think it was pretty awesome to see the bike patrol start. It's a great way to be proactively policing, and it's also a great sign of spring. So welcome spring, and thank you for this time in front of you today. Appreciate it.
All right, great. Thank you. Chief's remarks. Chief Prouty. All set. Thank you very much, sir. All right, with that, I will open up to general announcements. Does anybody have any general announcement that like to come up and speak about? We have a hand. Jamie, come on up.
Hi, everyone. Just wanted to let you all know that the third episode of Vision in Action is live on Spotify if you use that to listen. And we will have a YouTube link to listen to that posted on the listserv, hopefully by the end of today, so people can access it that way as well. We interviewed Rich Eckroat, which was great. Talked a lot about Project Vision and Situation Table. So if you get a chance, check it out. Thanks.
Thank you. If that particular podcast got a lot of listens, that's because of my mom. That's not a joke. Any other general announcements from anyone? Step on up.
Carissa Burnell, Co-Executive Director of the Parent-Child Center, just here once again to plug the third annual Running for Prevention. It's just a couple weeks away, April 25th, Saturday. Registration does end the Wednesday prior. There's no same-day registration. We have a huge carnival after, food truck, bounce houses, face painting, magician, touch-a-truck. You name it, we've got it. It is our only fundraiser for the year, so we are hoping to see a huge group of folks out supporting us. We are partnering with the Rutland City Police Department and the Child First Advocacy Center. There are prizes for people who are runners, and for those who are not runners, come and walk, because there's a food truck and ice cream after. So I hope to see everybody there. Thanks.
Thank you. All right. Step on up.
Hello, Kathleen from NAMI Vermont, and I would love to follow the Parent Child Center because after you get warmed up at their walk, you have an opportunity to come to Centennial Field, which is in Burlington. I know it's a bit of a drive, but this is a statewide event for NAMI Vermont, the National Alliance on Mental Illness. It is our one large fundraiser of the year. However, fundraising is only part of that goal. My goal is really to create a safe environment where people can come and be bravely themselves, and those of us who have a connection or a why to this mission can connect with other people because we know human connection and relationship is our biggest protective factor. So I myself am a suicide loss survivor, which is why after 28 years in public education being a principal, I left and switched to mental health. And so now I educate, but I educate in mental health. Anyway, this walk is May 16th at Centennial Field. 2 food trucks, a live band, Made in Vermont a cappella group. What am I forgetting? Oh, Froggy FM is going to broadcast live this year. And we have a silent auction. There's a lot of things going on. It's a whole festival day. It's very family oriented. It is free to come. You do not have to fundraise. It's much more important you're there. The reason I'm telling you about this is A, you can come be a participant. You do have to register for free. Or I'm offering a free vendor table to any nonprofit who would like to come be part of our resource fair. So typically we'd call it like a wellness fair, but that sort of implies we're not well. So I thought it would be more fun. Who doesn't love a great buffet, right? Where you just come and pick the kinds of things you like. So our resource buffet currently has over 40 statewide partners and nonprofit vendors, and we'd love to have more representation from outside of Chittenden County. This is a statewide event. So with intention and purpose, I'm here today to invite you. Tabling, typically when you look at our brochure, it says it's $500. It's not. If you come talk to me and you're a nonprofit, I'm the event coordinator, I will make it happen. So please think about joining us on May 16th at Centennial Field. Thanks.
Springtime events coming up. Anybody else? Any other general announcements from anybody? All right, well then I would like to welcome up Heather Rigney to present on the Medical Reserve Corps for our support pillar. I'll get out of your way.
There we go. Can everybody hear me? All right, awesome. So thank you for having me today. I know many faces in the room, or at least many of the organizations represented. I'm very excited to speak to all of you today regarding the Medical Reserve Corps program and how we work here in the state of Vermont. I have given this presentation as if you don't know anything about us because I figure it's easier to level set and let you know a little bit more about who we are and what we do. I would absolutely encourage any of you, in our Q&A session just to talk about the partnerships you've had with MRC if you've had an experience with us. After I speak, Eric is going to talk about a great partnership that we are promoting with Project Vision here in the Rutland area and how you can become more involved. All right, so what is the MRC? Basically, we are a national organization. We have been around for 20 years exactly at this point. We are community driven and we are basically here to be a gap filler for our local communities. We have a focus on public health and health care. So that we can support our communities when there are gaps, when there are emergent needs in the community, and we are very locally driven. However, we are actually a national organization, and I'll go a little bit more into the structure of that later on. So you'll see us from very local community all the way up to the federal level and beyond. Our strength is in our volunteers, and currently we have 600 volunteers here in the state of Vermont doing a variety of missions with our community partners. So, as I mentioned, we've been around for about 20 years. We were actually formed in the aftermath of the 9/11 terrorist attacks, when a number of spontaneous volunteers came out to the plane crash sites wanting to help in some capacity. The majority of those were medical personnel, doctors, nurses, behavioral health individuals. A lot of them were just, regular bystanders who wanted to do good work. But they didn't understand how to work in an incident command structure. They didn't know who was in charge and what the process was to get involved. And for all the amazing activities they did and all the contributions they made, the response was very disorganized. So seeing that and wanting to channel a way for these volunteers to help, former President Bush, who was overseeing this at the time, decided that he wanted to create a pilot program to try to background check, organize, train volunteers with these types of skills into a group that could be mobilized in emergencies and deployed to work in a disaster environment. And that's how the MRC basically became a thing. There was a pilot program where 6 units were created throughout the country, and I'm really excited to say that Vermont had one of those 6 pilot programs. Our MRC of Southwest Vermont, which covers our Bennington area in the far south of the state, was one of those 6 units. They and the other pilot programs worked from 2002 to about 2006. And as you will see here, there was one catalyzing event that really launched MRC nationwide, and that was Hurricane Katrina in 2005, and the response of the MRC in New Orleans, which was one of the other pilots, being able to work in the depth of that disaster and really provide essential services and lifelines for a number of individuals. So that is when it became a nationwide program. Since then, we've had a lot of trial cases with big national disasters. Most of these you will see are big hurricanes, but MRC has been active in floods, in tornadoes, in wildfires, man-made disasters. Certainly within our own state, we have participated in the COVID pandemic. We have participated in the 3 years of recent floods, a number of other initiatives. But through trial and error, we have been around and growing stronger for over 20 years. Congress did move the Medical Reserve Corps under the Department of Health and Human Services, under ASPR. So I don't know how many of you know who ASPR is, but it's the Administration of Strategic Preparedness and Response. That is our home within the federal government. They provide all kinds of initiative and direction to the MRC, guidance to the states on how to administer the program. And then again, the state takes that, enrolls all those requirements out, and works with the local MRC units to make sure that certain criteria are being met, but really for the most part gives them autonomy to do their own thing. So a little bit more about MRC National. Every state and U.S. territory has at least one MRC unit. They range in size from the super small, just a handful of volunteers, all the way up to units that boast more than 10,000 volunteers. We are a small but mighty state. Our biggest unit has about 200 or so volunteers. Our smallest unit has approximately 40. But again, all of those folks are recruited from the community and live in the communities that they serve. As I mentioned, we fall under the Readiness Division of ASPR, which is part of Health and Human Services. And again, we get grant funding from the federal government. They provide a lot of best practice. They provide a national conference for us where we can learn from peer leaders throughout the country. They do a lot of great work, so if you have an opportunity to visit their website, I certainly encourage you to do that. The other thing that I'm really excited to say that MRC is a part of is this organization or network called ESAR-VIP. What this is basically a standard for credentialing all of the medical professionals within MRC to make sure that our licenses are checked, that we are background checked to a certain standard for that very deployability that we were created for during 9/11. When we send an MRC individual who is medically trained out to a site, be it disaster or non-disaster, we are basically certifying that they are available in the scope of practice that they say they are, that they are cleared to work with our at-risk populations. And that could be, medically fragile individuals, that could be the extremely young, our older population, anybody that we consider, vulnerable or at a higher risk. That's really important because we work alongside a lot of other national organizations that are also held to this ESAR-VIP standard, such as the American Red Cross or the National Disaster Medical System. All right, so here in Vermont, we do things a little differently sometimes. Our mission basically mirrors, for the most part, the mission of the federal MRC program, but we really pride ourselves on being hyper-localized. You know, whether you call us out for being first aid at a road race or a community event like we just heard a number of speakers announcing, all the way up to whether we're sending, hundreds of vaccinators to work COVID clinics 7 days a week for 3 years straight. We really pride ourselves on developing those partnerships, finding out where the need is, working with our partners, and making things happen. MRC in the state of Vermont is administered by the health department. So I am a health department employee. Eric, who is one of our unit coordinators for the Rutland unit, again, is a state employee. What the state does is we provide some administrative control, so we'll process grants, we do all of the federal tracking of volunteer hours, we work with our community partners to do education, to set up meetings, to coordinate responses. We also have a number of incredible volunteer leaders that help our paid staff do that type of work. During non-emergency times, our MRCs are pretty autonomous and they can create relationships within the community as they want. During a larger scale emergency like a state or federally declared disaster, our volunteers roll into the health department and they basically become our boots on the ground. They are our operational folks that go out in the community and will help promote health department programs to provide the community lifelines and move people from response to recovery in the aftermath of a disaster. This is just an image of our MRC units and where they are in the state. So you guys are in the light blue on the western side of the state. Rutland Addison MRC unit is the unit that serves your area, and Eric Pulver and Dee Mervang are the two unit coordinators that support your area. If you want to find out more about these other service areas, you can go to our MRC website, and this is an interactive map that will show you what towns fall where, and the contact information of all of the other units as well. So I've been mentioning MRC units. We are organized geographically into units which cover one or more counties. Those are centralized in our health department offices. So we have 12 district offices, and one or more of those are contained within the service areas of the MRCs. We also have what we call groups, and those are more functional areas. So things like emergency sheltering, or medical surge, or auxiliary communications. Those are all missions within the MRC, and we have volunteers who train to a certain standard to be part of a certain program, and they fall under these groups. So say we need psychological first aid instructors or stop the bleed instructors. We can reach out just to those specific groups to mobilize those folks to respond and to get them in touch with opportunities in the locale. If it's something more general that all volunteers would be interested, we usually send that out at a unit level. All right, I also want to talk a little bit about liability. Because when you're calling up MRC to partner with you, I think it's really important that you as an organization know a little bit about how we work. Because MRC is affiliated with the state of Vermont, we are super lucky that we can background check all of our volunteers, and that when they mobilize through the health department, they have the same general liability and workers' comp that any state employee would have. So part of our background check process means that if we are working with you, we have a liability form signed. We track those volunteers from when they arrive on site to work with you to when they leave. And if anything happens, that falls on us. We usually have our partner agencies just sign that liability, so they are saying that they're going to provide supervision on site, that they're going to orient our volunteers, those types of things, but they know that we actually, protect these volunteers. When we have professional liability, however, that's a little bit different. So our medical folks only work scope of practice for a state or a federally declared emergency when they're actually under the medical direction of the health department. Non-emergencies, we're usually just doing things like first aid or CPR or anything you could teach to a lay person. So again, how we mobilize our medical people just changes a little bit depending on the situation. All right. I firmly believe in this statement. You know, we can have 600 individual volunteers, or we can have an army of folks that make an incredible difference. Last year, we ran our federal report and saw that we had provided over 144,000 hours of service to the state of Vermont just with our MRC volunteers alone. That is an incredible number of hours. That is an incredible amount of work with really dedicated and passionate people. You could not pay $145,000, people to do the work that they have done. We have, like I mentioned, a number of missions that we support that are really at the core of what we do as a state MRC program. They can be organized into medical surge, education, and auxiliary communications. Within each of those sections, you'll see that there are a lot of different subheadings here. Like under surge, we can set up and deploy portable hospitals. We do family assistance work, so that's working in a disaster medical, disaster mortuary type of situation to do reunification work. There's a whole different spectrum of things that our volunteers are trained to do. Again, we also have that really hyper-localized aspect. So we have individual units that have taken on certain missions that are passion projects for them. We have a couple of units that really believe strongly and have an emergent need for things like oral health care, foot care. We have folks that do fall prevention work. Here in Rutland, you guys have an outreach care team. It is a one-of-a-kind, but it does phenomenal work with its community partners. Our work that's going to be going on with Project Vision, again, is going to be a hyper-localized thing, but it's a model that we can use to give to other units that have similar programs in their communities and expand. So I always tell our volunteers, if you have an idea, if you are part of a group and you see a gap, bring it to our attention, because we can design a mission and we can recruit volunteers to fill those needs. If you are interested in learning more about the MRC, this is our website, oncallforvermont.org. It is a site that is run through the health department. It has a lot of great information on it. There's directions on how to register for the MRC. There's that unit map that I mentioned. There are testimonials from our volunteers and a Volunteer of the Month section. There's back issues of our newsletter. Sometimes we'll highlight a feature article or event that we've participated in, an emergency response that we've successfully gone through. So if you want to learn a little bit more about what we do as an entity here in the state, this is the place I would absolutely direct you to go. All of our volunteers, like I said, if you register, you are going here through our responder management system. This is how we track all of our volunteer profiles, how we communicate with our volunteers, how we alert them in emergencies. All of our members are part of this structure. Some of you may know this because we also share this site with Serve Vermont, which is the spontaneous volunteer site that VEM runs. So really great place, really great organizational tool that we use. We also have our volunteers take a variety of trainings, like I mentioned, to get them all on a level playing field. So things like, HIPAA, bloodborne pathogens, personal preparedness so they feel comfortable leaving their families to respond to us. A little bit on incident command system. All of these things. These are the types of trainings that we require all of our folks to take. And then we offer other trainings throughout the year. So whether you're an MRC member or not, a lot of these types of trainings we open to the public or to our partners to come in person or virtually. So if there's something you want to learn, whether MRC teaches it or whether we bring in a guest provider, I would absolutely encourage you to say, hey, do you have any leads on where to find this, or can you provide this for us? Do we have time to do the video? I would love to do the video if we can. Okay, awesome. So this is the recruitment video that we made last year.
Briefly, while we wait for the video to get loaded, Eric set up a table in the lobby. I'm not calling you up yet, but Eric set up a table in the lobby with some general information about the Medical Reserve Corps. So on your way out, when we're doing networking, please feel free to stop by that table, grab a pamphlet.
Hey, thank you for joining us. Can you introduce yourself for me, please?
My name is August.
My name is Jackie. Barb.
Ian Spears.
I'm Wally.
Suzanne. Rebecca.
Paul.
Can you tell us why you joined the Medical Reserve Corps?
I wanted to be a part of helping improve access to healthcare.
To make our community better.
I joined the MRC because it seemed like a good place to embrace the idea of community preparedness in what I see as an increasingly uncertain world.
To give back to my community.
I wanted to work with the MRC because I see the value of community connectedness. I understand that when we work together, we build a better, stronger, more resilient community that's capable to respond to emergencies and disasters.
What do you like most about being in the Medical Reserve Corps?
I like being able to continue to give back to the community.
It's the opportunity to actually make a difference in somebody's life.
I love being out in different communities and meeting different people, having really unique opportunities to use my healthcare skills.
And it's an opportunity to speak with the people that have little access.
I think the crew is incredible. And there is a camaraderie that you can count on the person beside you or with whom you've been working with. Even though we have different views, we all walk toward the same goal.
We just don't know what the world's about to hand us, and we got to do for each other a little bit, I think.
It's a lot of fun to work with our partners and be able to secure different ways that we can help our community be better prepared.
I like the opportunity to train and provide people with the resources, skills, and techniques necessary to preserve life in the event of emergency or disasters.
Thank you.
Thank you. All right, Eric, I will hand this off to you.
Why you gotta be so tall? I always gotta do this. I always gotta fix this. So I want to thank Heather for coming over here to talk about sort of the MRC as a whole, and I'm here to kind of talk about a little bit of more localized aspects of this. So as Heather mentioned, I do, if you don't know who I am, I should probably do that. Eric Pulver, Emergency Preparedness Specialist for the Department of Health. I work in the Rutland District Office, so I work right here. I get a lot of people that they talk to me and they ask, oh, did you come down here from Burlington? And I say, well, no, I live in Castleton and I work in Rutland. So I'm right here. So I know what's going on for the most part. And so, yes, I do co-coordinate our Rutland-Addison Medical Reserve Corps unit, and we do a lot of things. As Heather mentioned, we do have Candace Rains. She is on the outreach care team, and she has been since the beginning when it started in 2023. So we're really super happy that we are, as the Medical Reserve Corps and our unit, able to be part of such an awesome team that goes out every single week and does a lot of great work in our community. So that's just one of the sort of things that we do. We, if you've been to any of if you've been to the State Fair, if you've been to the Addison County Field Days, you might have seen a misting tent. So that's another aspect that we do a lot here in our unit, is we do a lot of heat preparedness and heat work. So we have multiple misting tents and multiple misting fans that we will deploy at events or with community partners to be able to use that. So yeah, so we do all sorts of stuff like that. And one of the main things I really wanted to talk to is a kind of an exciting partnership that has been in the making for quite a while, which is a joint partnership with Project Vision. And so the real thing we want to do here is sort of twofold. It's a win-win situation. Project Vision has always wanted to have a volunteer corps, a volunteer committee, volunteer, whatever you want to call it. But it's always had a little bit of a few struggles, most notably around background checking and liability, because as Heather mentioned, as sort of part of the state, we have that built in, but Project Vision doesn't. So the police department would have to pay for all of that, and so that would be a little more difficult to do. And so that is sort of the win-win for Project Vision side, is that the Medical Reserve Corps, if you are interested in volunteering, we will supply those background checks and we will supply the liability for approved events, approved programs that you want to do. And on my side, as the win-win, I get you. Anybody that's interested in volunteering, anybody that wants to join the Medical Reserve Corps, that is what we're really looking for, is more people. And I know we say medical a heck of a lot. When we say MRC, you don't have to be a medical professional. You don't have to know anything. We will teach you CPR. We will teach you stop the bleed. But really what we really are interested in is people that just want to go out and help. You don't have to have that medical training. You just want to have that desire to help your community and to do things within it. That's what we're really looking for. So that's the main piece of this partnership with Project Vision. And there's a couple of other pieces that we're really interested in as well. One of the notable things here is I'm going to put a certain person on blast here. He probably doesn't want me to do that, but I'm going to make him stand up. So our wonderful Adam Sansick has offered to, as part of a lot of community work, is to sort of coordinate a little bit more of the volunteer aspect of Project Vision. And so some of the things that we've talked about we want to do is we're going to put a page on Project Vision's website that is going to link directly back to On Call for Vermont and sort of give information about the Medical Reserve Corps. And we want to do other things with that website. And one of those things is we want to sort of coordinate some of the volunteer opportunities within Rutland City and Rutland County with everybody else. So that's another aspect here that I'm up here for, sans MRC, is to also talk about if your organization has need or does a lot of volunteer work, we want to talk to you. We want to sort of do those partnerships. We want to collect that information. We want to help support that communication, that coordination, and that collaboration amongst all of us. Because we are not in a massive county. We have 60-ish thousand people. And that's the pool we have to work with for volunteers. And so, we can't all, necessarily get all the same volunteers all of exactly the same time. And so that's an area where we really want to be able to support that effort. And so if you have any questions on the organization partnership side, if you want to partner with the MRC, you can talk to me. If you want to do sort of more of that Project Vision, supporting community volunteer collaboration, you would talk with Adam Sansick. He'll be able to kind of collect that there. And so, yeah, that's kind of the sort of where we're sort of getting to right now, is we really want to get this off the ground. We want to get more collaboration. We want to get more of that coordination amongst all those volunteer organizations and needs. Because as if you were here in last September when we did the organizational showcase, what we really kind of, one of the big things that came out of that was organizations asking for volunteers. And so that's one of the ways that we're taking information directly from the organizational showcase and putting it into action, is to be able to hopefully do that coordination. So, Adam, did I miss anything? Yeah, perfect. Do you have any questions about either our partnership we're doing with the Project Vision? Do you have any questions about the MRC? As Rich said, I do have some information out in the foyer for our networking event, to take some flyers and stuff like that. But yeah, any questions? Mayor. Yes, yeah, we love to do our sheltering work. That's one of our primary missions. And so, yes, thank you for that. And also, that reminds me is that the MRC actually supported our this winter's extreme cold weathers while we were doing it at the library. So, yeah, we're there. That's one of our big things that we want to do. And, yeah, questions, thoughts? I really want to move, and this non-wireless mic is killing me right now, but awesome. Well, if you do have any questions or any of the other follow-ups in the future, please do get a hold of me or Adam, and we'll be able to kind of hopefully build this from the ground up and really get everything moving and grooving. So thank you.
All right, before we move into networking, we missed something last month. Does anybody have a positive story they would like to share? Who has somebody out there has something positive to share with this group? I see a hand in the back. Come on up. Okay. Speak loudly then. Oh, amazing. Thank you so much. Huh? Okay, behind the TV. That was amazing. Thank you for sharing that. Great. Well, without further ado, I would like to open it up to networking in the lobby and pizza. And I think we are going to have the recruitment video playing on loop potentially. All right, well, we'll have this playing on loop. Eric, would you like to show this now instead? Okay. This will be playing on loop if you want to come back in. Thank you. I will mention. Thank you, Jamie. I'll mention it again. The QR code. Let us know how we're doing. Thank you.